a grand day for me. I get reunited with someone I adore. I love Amy Gilbreath. She does so many amazing things in nonprofit, and then she became the president of PetSmart Charities, which is a pretty big position. Is it amazing to be at the top of the nonprofit heap as a woman, in the nonprofit heap in the whole country?
I hadn't actually thought of it that way, but I
Yeah.
love being here. I love the work we do. I love our team. I love the partnership that we have with PetSmart. I feel very honored and privileged to get to lead this organization.
It's been a while. When I
Coming
first
up on
worked,
5 years.
oh my God, 5 years. I knew Amy when she worked at a different nonprofit in Los Angeles and did amazing things, developing new companies that were coming along in the pet space and doing a lot of spay neuter stuff. But PetSmart Charities is quite a jump into a pool of money that you can allocate for good for pets, which you're pretty creative. How much of the decisions of where the money goes are on your shoulders?
Oh, great question. So, one of the things that was the biggest adjustment in coming to PetSmart Charities, because this is a grant making role. And previously, the organization I was with, we did a side order of grant making, but our main course
Yeah.
was direct programmatic work. And when you know about PetSmart Charities in the industry, it is a big name. We are the largest funder of animal welfare in both the United States and Canada from a grant making perspective. And so I had the impression coming in that, oh, PetSmart Charities must have so much money they can fund all the things.
Yeah.
And we have a lot of money, but we don't have a lot of money compared to the need in animal welfare.
Oh,
So
and
we have to make choices
mhm.
and have a strategy about what we're funding and what we're not. And so I work really closely with my team, who are wonderful. And over the course of a few years, we've put together a set of programs and guidelines and parameters. So I am very actively involved in the strategic part of deciding what we fund. But then once we have set up the idea, for example, that we want to engage with shelters and rescue groups in a particular way, or we want to engage in pet hunger in a particular way, then I let the experts on my team do their thing. And
That's great.
I stay out of their business. And they
Yeah.
come to me and say, we want to fund these things for these reasons. And I ask a few questions. And then I say, great.
That's what a great leader does. It's why you were a great leader. We could just say Michelson Found Animals is where you
Yep.
were, which was a confusing kind of a nonprofit because it shifted, always for the good, but it was different kinds of good. And when you were involved in their lab, I forget exactly what it was called, but I was really amazed at the wide variety of grants that you were part of deciding who was doing some grassroots work and who deserves some of the money, and then you could mentor them along. One of the things that you're focused on now is about veterinary care for
Yes.
pets, and I think that's very forward thinking because it's a problem now, but it's probably going to get worse. So talk
Yeah.
about why you chose that.
We do think it's going to get worse before it gets better.
Yeah.
Even before I arrived at PetSmart Charities in 2020, the previous leadership team had been starting a strategic and vision transformation. And what that was led by was good news in a way, which is that over the last 30 years, due to the work of a lot of groups, shelter intake is down and shelter euthanasia is down even more. And
Right.
so now, if you look at animals who are at risk, the number of animals who are at risk of an unnecessary euthanasia is tiny compared to the number of animals who are at risk because they live with a family who may struggle to provide for them. And many of those families are also struggling to provide for themselves. So when
Yeah.
you look at the numbers in terms of pets who aren't getting adequate veterinary care or pets who live with a food insecure family, it's orders of magnitude, many times larger than the number of animals at risk of euthanasia. So PetSmart Charities had already started shifting a bit and investing more resources, although this goes way back. PetSmart Charities has supported spay and neuter, which is a version of access to care,
Good point.
for 2+ decades.
Yeah.
So it was a matter of saying, okay, how are we going to morph and shift and invest in this? And so from our PetSmart Charities perspective, lack of adequate, affordable, accessible veterinary care is the biggest issue facing pet families. And so that is where we are putting a lot of time and energy trying to figure out how to help.
So you have statistics. You did a study. And I guess in order to be such a big company, you can't just say, gee, I've noticed vet care is getting more costly. And I know someone that forgets spay and neuter, can't vaccinate. can't have a tumor looked at. So let's just do that. But you needed a study because you're talking a big ship that you're the captain of with a lot of ballast, if you will, which is the money, but you can't
Yeah.
just throw it overboard and hope it reaches its destination. So when you fund, if fund is the right word, a study like that, how do you pick the people that are going to do a good study that really will be valuable to you?
So a little bit of background, you're absolutely right. Oh, a little over 2 years ago, almost 2.5 now, our incredible board, we have a wonderful board at PetSmart Charities, let us commit to a $100 million investment in access to care programs over 5 years.
Wow.
And we had come to them with all of the strategic underpinnings and the tactical how we were going to do it, et cetera. And they were aligned. And there was enough data out there at the time to illustrate why this was a big issue. And then they said to us, if you're spending $100 million over 5 years, we'd really like to know if it's having an impact. And while there were
That's
some,
funny of them. Aren't they funny monkeys? Yeah.
yeah, it's their responsibility to make sure we do right by our donors. So
Yeah.
it was a good request. And there's not a study out there that looked at the issue the way we wanted to look at the issue. So we thought we need to generate our own data, both to guide our programs, to guide conversations in the industry, and then to measure impact over time. Although, as you mentioned previously, we fully expect it to get worse before it gets better.
Right.
So we went to Gallup because Gallup is the best in the
Wow.
survey business, very well known, very expert at this. And we worked extensively with them to develop a survey of pet parents. And we plan on doing that every other year ongoingly. But then we also are going to launch in the years we don't survey pet parents, we're going to survey veterinary practitioners because both perspectives are important.
Wow. That's amazing. A Gallup poll used to be the only poll. Before, now in politics, there's so many. Who did that poll and how many people did they talk to? Gallup is the gold standard. So that's really smart because otherwise someone can say, yeah, but was your poll done correctly? Or did you only go to poor places?
We don't have this expertise in house, so we definitely needed a partner. And we absolutely wanted to go to a credible partner who knew what they were doing and really would really help us design a solid instrument.
So they came out with number
Mhm.
52, and I'm not a numbers person because I think people listening or nowadays watching us blab, but you guys really don't have to watch us blab. You could just listen, but never mind. You all want to look. Okay, hi, here we are. 52%, half of the people that own pets have not gone to the vet because they couldn't afford it. And that isn't just in areas where there weren't vets available or everybody's below the poverty line or something. That's 52% of Americans, right?
Yeah, we made sure, and this is again a reason to work with Gallup, we really wanted coverage across all demographics. We wanted urban and rural and high income and low income and age groups and income groups. And so they made sure that our sample was very diverse. And we knew that this was an issue, and we had anecdotal evidence that it was creeping up the income scale. I think a lot of times folks think this is only a poor people issue, that
Right.
it's only very low income households that can't afford care. And it was over half of pet parents either have not brought their pet to the vet at all, even though they thought they needed treatment, or have gone to the vet and then declined one or more of the care recommendations the vet was making. And of those people who were either not getting care or declining care, over 70% said it was some sort of financial reason. And then where it gets interesting is that the two biggest financial reasons were either I could not afford it, simply could not afford it, or I did not think it was worth the cost. And
That's
that's where
interesting.
we see things get interesting by income bracket. Lower income households are more likely to say, I could not afford it. But still, fully 1 in 3, Tracie, 1 in 3 households over $90,000 in income say they are skipping or declining care because they can't afford it. And then more than that are saying they're skipping or declining care because it was not worth the cost.
It wasn't a good value add to their pet's life or wellness.
And this is a really tricky nuance. And this is where surveys sometimes leave you with additional questions that in
Yeah.
hindsight you wish you had asked, or that next time
Yes.
we'll ask differently, because we did ask a question of the folks we were surveying, in general, do you value vet care? And 80+% in general said they valued healthcare. But then when we were asking a question about declining specific care, way more people than maybe that 15% who said they didn't value care at all had declined care because it wasn't worth the cost. And so the way we think about this is that pet parents respect veterinarians and they value the advice and the care that veterinarians give them. And also the circumstances of their life happen. And so if they're showing up one day and they get quoted $1,500 for a dental, that particular price for that particular service at that particular moment in time, given what's going on in their life, may not be worth the cost, even though in general they value veterinary care.
So I can relate to that myself. My sister has a 14-year-old little dog, and I said, you must go to a veterinary specialist. Your own veterinarian, I don't think, gave you the advice that you needed. Bossy older sister, of course. So I strong-armed her to go, and she's called me from VCA Specialty Hospital, wherever it was in Connecticut, and said, they want to do an ultrasound. I said, yeah, that would be the standard of care for this issue, to do with kidneys and maybe liver. And she said, but it's really expensive. Now, this is what's interesting, Amy, because you're talking about psychology and ideology. It isn't the dollar amount. I said, sister, you have pet insurance because I've strong-armed you into getting it. It would cover it. And do you know what she said? Oh, I didn't realize that. So there's somebody who could afford it, is supposedly reasonably intelligent, but the number quoted, whatever it was, it must have been north of 1,000, let's say, I don't know for sure. The attitude was, oh, that's not worth it because who knows what they'll find. And maybe she even thought she's 14, how much longer she got to live anyway. So is this part of what you're talking about? Just a kind of a knee jerk, like, whoa, 1,000 plus for various things, which is common nowadays in vet care. And people are like, whoa.
Firstly, as one bossy older sister to another, thank you for making her get pet insurance and giving her good advice.
Yeah.
I would say that sticker shock is a huge issue because we know prices of everything have gone crazy in the last 5 years. And veterinary care has risen faster than other costs. So people are getting these quotes that just feel so off and so different and so out of the ballpark of what they were expecting, which is one part of it. And then another part of it, particularly in the case of folks who either have a wellness plan, an insurance plan, something like that, is we're all, I think, conditioned by the way human healthcare works. And all of the veterinary plans work very differently. And so many folks are very confused about what their plan covers and doesn't cover. And then there's the element of, in most cases, even if you have insurance, you still have to pay up front and then submit for reimbursement. So it's complicated. It doesn't work the same as human healthcare. And I think a lot of folks are confused.
They're confused and frustrated. And in my case, as an advocate for pet insurance, back when I wrote the Dog and the Cat Bible, there's still only less than 5% of Americans who even have it. So we're not talking to the choir here. I still say to people, you need it because listen to the numbers. Listen to the Gallup poll that PetSmart Charities paid for. Listen to the fact that if you want to get any kind of even vaguely sophisticated care, you probably can't afford it cash on the barrel. But I'm dealing with a $1,550 dental on my 10-year-old Wanda, who had a fractured tooth, and there were 2 other bad teeth. A lot of people say, well, how bad's a fractured tooth? I don't know. Anybody out there ever had an abscess? Anybody out there ever had a cracked tooth? Wow, it hurts. Do dogs and cats cover it up? Completely.
Yeah.
So it's complicated. So you go in and you get this estimate and you think, what? For a tooth? Give me a pair of pliers, I'll pull out myself. I'm kidding, kind of. It's hard for people to understand. Those vets have special training and tools and equipment and dental x-rays. They're not pocketing your $1,550, folks. You know, they're making
it is expensive to run a clinic.
Yeah.
And it is expensive. One of the things that's happened over the last couple of decades, which is awesome in some ways and challenging in other ways, is we have options now that we didn't used to have.
Yeah.
You can do chemotherapy for your dog. You can do orthopedic surgery for your dog.
Yeah.
So it used to be if your dog had an ACL rupture, that the option was basically pain management, crate rest, it would heal. They would have okay mobility, probably great quality of life.
Yes.
And now you can get that ACL repaired. It's $7,000.
It is. Yeah.
And you do probably get a better outcome. You do probably get better mobility and maybe better quality of life than doing pain management and crate rest, but it's such a huge delta in cost. So as we've gotten more sophisticated and we've humanized veterinary medicine, the cost of care for everything has gone up a bit. And what's considered the gold standard, which is now becoming a dirty word, has gotten much more expensive. And when it comes to insurance, for example, when I go to the doctor, I don't really pay attention to the actual cost of care because my insurance premiums are subsidized by my employer and I pay copays or I pay a percentage, but I don't have to worry about that full cost.
Right.
And there is no one to subsidize your veterinary health insurance premiums. So you are going to pay the sort of actuarial estimate of your pet's cost divided over time.
Yep.
And I
Which
think
a
that's,
lot of
again,
us
hard for folks to conceptualize. They're used to not paying the full cost.
a lot of us do that in human healthcare. Those of us who are self-employed, we've been paying out of pocket forever. So even if you get to be ancient, like me, and you get Medicare and then you get supplemental Blue Cross or something on top of it, you're basically still paying for all of it. It's just that it's invisible behind the curtain. It comes out of your paycheck or out of your Social Security or something. So you think, hey, that's great. It's all covered. We're still only talking to this tiny part of the audience that got insurance at all. So you don't have insurance at all? Yikes. I think part of what you're trying to do at PetSmart Charities is talk about this gold standard and the fact that possibly you do not have to do chemo. It doesn't make you a less loving owner. It doesn't make you a less protective one. And I don't know, I've had, until I stopped spaying and neutering my large breed dogs, every single dog had an ACL tear and then a second, because that's the statistics. And they were 5 to 7 or 8,000 each, with enormous amounts of pain and suffering for the dog while recuperating. Therefore, pain and suffering for me, who identifies
Yep.
with every living creature. Maybe that old let scar tissue form and let it fix itself, some human orthopedist will say about knees, maybe that is the way to go. Is that part of what you've come up with as an idea for owners, that they not feel? I'm not saying the vets pressure you into it. The vets offer a menu of what you could do. Do you think people feel some pressure, obligation to do everything possible, and no matter what the cost?
I do think that folks feel a lot of pressure and a lot of shame around wanting to do the very best for their pets who they relate to as family members, and then feeling terrible that finances would drive a decision.
Yeah,
One of the big things we want to share with folks coming out of getting this data is you are not alone.
right.
Half of American households are struggling with this.
Yeah,
So don't feel bad. Don't feel ashamed. We all know that the amount you love your pet has nothing to do with your bank balance.
yeah.
And then we have some tips around, given that, when you go into a veterinary appointment, talk to that healthcare team about your constraints and concerns. Tell them what you're struggling with, because that will help them develop a treatment plan or offer you options that may be more affordable. If they don't know that you have this concern or consideration, they may not be upfront about offering you as many options as are possible.
Right.
You can ask if you can stage things, like what really has to happen today. You
Mhm.
can ask about payment plans. You can look for low cost and nonprofit resources in your community. There are things you can do. And I think psychologically, all of those things you can do work better if you're willing to acknowledge, hey, this is going to be a challenge and I may need some help. And that's a
Yeah.
really difficult first step sometimes.
It is, because we don't want to admit there's so many things in America that we don't admit to. We don't admit to grief after somebody or some animal has died. We don't even want to deal with impending death in people or pets. And
Yep.
we don't want to talk about the fact that finances are tight. It's almost like a shameful thing. And
Yeah.
really, it's we have to take the stigma off of all those things, because in the end, it becomes emotion rather than fact. So you emotionally are almost on the verge of tears to say, I don't think I can afford that.
Yeah.
And the vet, I've never known a vet to say, really, that's how you value your pet. The vet's grateful. That's why it's good that you're going to do another Gallup poll to talk to the vets, because they're in a really awkward position. They don't
They
want to
are.
presume because you drove in, I'm making this up, in a beater car, right? That you don't have money or whatever other thing, whatever it might be that gives the impression you don't have excess expendable money to pay for this. So how's the vet? They don't want to offend you by saying, I know the address you live at, or I know whatever the facts might be that indicate that you aren't
Yeah.
financially, they can't comfortably say, could do very little or nothing, or let me just give you some pain medication instead of a big old workup for north of $1,000. They can't do that unless you say, I'd love to do all of it, but there's no way because I still haven't paid my taxes yet this year, or whatever you might
Right.
say.
Or
Human,
I just had a big unexpected medical expense
yes,
myself, or for
yes,
a family member, or a car
yeah,
repair, or life
yeah.
happens. Veterinary approaches on this are evolving over time. And one thing that's really important to remember is vets got into veterinary medicine because they love animals
Yeah.
and they want to help them. So veterinarians are not the enemy here. And they actually graduate veterinary school with the highest debt to income ratio of any profession. So
Ouch.
many veterinarians graduate with what the rest of us would consider a mortgage worth of student debt. So they have their own challenges and constraints going on. And I think there was a period of time over the course of the last 20 years where, because there were so many technological advancements coming out so quickly, many veterinarians got trained on this gold standard high tech care. And they're now realizing that's great, it's awesome, that's available, but that's just one type of care along a spectrum and in context. And for them to be able to offer you contextual care for you and your pet, they have to know what your context is.
Yes.
They
Very
need
well
you to
said.
share that.
And they can relate to it. And they
Yeah,
can relate to it, as you said, because they're drowning in debt or they're suffocated by it. And the other thing for people to really recognize is that individual vet is an employee. They have a
mostly.
paycheck. And most of them aren't working on commission, like at Saks Fifth Avenue,
No.
trying to force you to buy a dress you don't want. They're really there doing their day's work for the hours that they've decided to do. And it's not going in their pocket any more than the lab fees when you have a $350 senior pet blood workup. That's not money the vet is using to get their own car tires changed.
No, what I
No,
will say, you're making a great point, is especially in larger practices, often the vets are employees. And so
yeah,
the individual vet may not have a whole lot of discretion or control over policies or what they offer. That said, I do think there are a ton of opportunities in the veterinary industry for the veterinary industry to take this data and realize that a lot of pet parents are not being well served by current care delivery models, and that there need to be more care delivery models and care delivery options to meet various people where they are.
yeah, like old fashioned. Let's go back to the olden days, which isn't to say you take the dog out back and shoot it. I live
No,
in Vermont, so that was like how they used to deal with things, or the West or someplace. I'm talking like the 1800s.
yeah,
Obviously not that far back, but something more in between. High
yeah,
tech care, which by the way, even when the vet is telling you this could buy you 3 more months. Okay, so $10,000 with lots of vet visits and maybe deal with reaction to whatever the treatment is. And I'm still only going to get 3 months. How many of us humans, when let's say there's cancer, which is the most obvious one, are told you can have this treatment, it'll get you 6 more months of life, but you're going to spend the last 6 months of your life having this treatment and not having
being
life.
miserable.
Yeah. And so I think a lot of people think that about their pets, and it's not unreasonable.
No, it's not unreasonable. And
But
I'll
I
just say
think
one
that
more
we're,
thing, as a place where the veterinary
yeah,
industry can catch up to the rest of consumer is
right.
payment plans,
Yeah. Care credit.
because the pay up front all at once is challenging, or the huge interest rate. But when my air conditioner goes out, I get offered 0% APR for
Right.
18 months.
Yeah.
Or in a lot of retail stores, the buy now, pay later, it automatically splits it into 4 payments,
Yep.
interest free. The veterinary industry is not yet using those options the way a lot of other segments are. And I think that would help a lot of folks, because I may not have $800 today.
Correct.
But if you spread that $800 over 4 paychecks, or
Which,
I don't have $10,000 now, but if I
right.
got 18 months interest free, it
Right.
makes a big difference.
One of the places that, and we're running out of time, but one of the places that does that is human hospitals. If anybody doesn't know this, if you, whether or not you have insurance, you can say to any hospital, okay, my bill's going to be X. Here's how much I can pay you a month. And it can be really low, not a huge percentage of it. And a hospital will go along with that because it's what needs to happen. In human healthcare, it's already happening. So I just have to say these are great topics that you've addressed. And It's all theoretical, but practice will follow theory. And I think that PetSmart Charities is doing something really great by shining a light on this and taking stigma out of it for the doctors and for the owners and for more comfortable outcomes medically for everybody. So thank you, Amy,
You're welcome. Thank you for having me. It's great to see you.
and to your team. And I look forward to knowing you'll come back after you do the Gallup poll on the veterinarians.
Absolutely.
That'll be really interesting. I'm sure they are dealing with a lot of emotions and realities just like
It's
we are.
not easy for them either.
No, it's not. Thank you so much for being here and all the good work you're doing.
Thank you.